Today we will discuss the classification of burns. On a basis of thickness, the burn is divided into 4 degrees. The first degree burn, the second degree burn, the third degree burn and the fourth degree burn. To understand it, let's recap the layer of skin. The skin consists of outer epidermis. Below the epidermis there is a dermis. The dermis is divided into two layers, the outer papillary dermis and the inner reticulodermis. Below the dermis there is a subcutaneous fat. Down the subcutaneous fat there is muscle and fascia, and at the end there is bone. So these different degrees will correspond to the depth of the burns. If in burns only the epidermis is involved, it is called as first degree burn. The first degree burns is also called as a superficial burns. But if the dermis is also involved with epidermis, it is called as the second degree burn. The second degree burn is also called as a partial thickness burn. The partial thickness burn is further divided into two types, the superficial partial thickness burn and the deep partial thickness burn. The superficial partial thickness burn means that the depth of the burn extends till the papillary dermis, means that it will involve the papillary dermis but will not extend to the reticular dermis. And the second one is the deep partial thickness burn. The deep partial thickness burn means that the depth of the burn will extend till the reticular layer. In short, whenever there is an extension of a burn into the dermis, it is called as a second degree burn, and the second degree burn is further divided on the basis of the depth of burn in dermis. So, other than the second degree burn, whenever the depth of burn extends till the subcutaneous tissue, means that it involves the epidermis, dermis and the subcutaneous tissue, it is called as third degree burn. The third degree burn is also called as a full thickness burn. At the last there is a fourth degree burn. The fourth degree burn means that it involves the extensive burn, means that it will involve epidermis, dermis, subcutaneous fat, muscle, fascia and bone. The fourth degree burn is found in electrical burns. These are the 4 degrees of burn on the basis of the thickness. Now come toward the clinical evaluation of burns, that how we will evaluate the degree or identify the degree of burns clinically. To evaluate the burns clinically, the investigation of choice is laser flowmetry. But we do not perform the laser flowmetry on routine basis because it is not available in many hospitals. So we evaluate the degree of burns on clinical ground. That means that we will perform the clinical examination. So what will be the clinical characteristic of burn? In first degree or the superficial burn, the burn will be painful, erythematous, it will blanch on pressure and it will heal without scar in 7 days. Apart from the first degree burn, in second degree burn, also called as the partial thickness burn, the characteristic feature of the second degree burn is blister formation. Therefore, whenever we find a blister on burn, we should consider that this is a second degree burn. But as we all know that the second degree burn is further divided into two types, the superficial partial thickness burn and the deep partial thickness burn. So what will be the differentiating point between these two categories? The superficial partial thickness burn, there will be a painful blister which will blanch on pressure. Along with that, there will the pinprick and the fine touch sensation will be intact, and this burn will heal without scar in 2 weeks. While in the deep partial thickness burn, there will be a painless blister which do not blanch on pressure, and in the deep partial thickness burn, the pinprick sensation will remain intact but the fine touch will be lost. This type of burn will heal within 3 to 5 weeks, but sometimes it produces a scar. Come toward the third degree burn. In the third degree burn, the characteristic clinical finding is scar formation. Means that there will be a scar formation and it will be a painless burn. And the clinical examination, the fine touch and the pinprick will be absent. In third degree burn, the scar is usually a circumferential scar, which will produce a compartment syndrome. So it is important to do a sclerotomy in a mid-axial plane in third degree burn. In short, whenever we find a scar in burn, we should consider that the patient is having the third degree burn. Now come toward the fourth degree burn. In the fourth degree burn, there will be an extensive burn which involve all the layer of skin along with muscle, tendon and bone. And the fourth degree burn is usually present in electrical burn. So it is all about the classification of burns. that how we classify burns on a basis of thickness and how we will evaluate the burn clinically and classify the burns on clinical ground.